As we start our 26 Personnel and Finance Committee meeting, and I'll start off with call to order and roll call.
Alder Horton,
Present.
Alder Sebastian, President, Alder Davis, Alder Lamb, Alder McCarthy.
Present.
That completes roll call.
All right, this time we have approval of the minutes for the August 12th, 2024 meeting.
Move to approve. Second.
It's been moved and properly second. All in favor signify by saying aye.
Aye. Moved by.
Opposed? Motion carries. Approved by, I think it was Alder Lamb first, make the motion, and the vice chair, Sebastian.
Okay, thank you.
All right, at this time, we're gonna have a change of order to the agenda. We're gonna start off with the item 2414-24. Go ahead.
Item 0214-24, communication sponsored by Alder McCarthy on behalf of the Waterworks Commission requesting permission to enter into a developer's agreement for the Hoods Creek Phase 4 Development Project HCP2 LLC developer. Recommendation of Waterworks on 521 was to defer. Recommendation of Waterworks Commission on 820 to approve with a referral to Finance and Personnel. Staff recommendation that the mayor and city clerk be authorized and directed to enter into a developer's agreement for the Hoods Creek Phase 4 Development Project HCP2 LLC developer. Fiscal note, the developer pays all costs associated with installation of the main at a cost of $170,000. Director Tillett is here to speak on the item.
Good evening, and thanks for having us here, and thanks for addressing the agenda. We really appreciate it. So this item is about a developer's agreement, a very small development, and it's going to be 10 single-family lots. It's kind of a Creekview Lane, which is just south of Northwestern Avenue between Fancher and Airline Road. So developer agreements, basically the developer is paying the cost of putting the pipe in the ground per our specifications, and then once they're complete, they turn it over to us and we maintain with the infrastructure afterwards.
Any questions?
Yeah, just to confirm our conversation at the Water Commission. This and the next item that you're going to present as well were both very small volumes of water in a sense. And hence, did not cause any deficiencies in the system that we need to worry about. That's why the commission decided to advance them, correct?
Correct, yeah, these are relatively small, like I said, each of them is 10 single-family homes. And the lines that they're putting in for this particular one are 8-inch and 12-inch. You can only get so much water out there, so small impact on utility.
Just like how I know there were 3 or 4 others we did not advance for those reasons. We need more information about deficiencies that would be caused in the system.
Yep.
Thank you.
Any other discussion? This time, or anything more?
Approved.
All right, I couldn't see.
Second.
All right, it's been moved by Alder McCarthy and second by Vice Chair Sebastian. All in favor signify by saying aye.
Aye.
Opposes? Motion carried. Next item.
Item number 0531-24, communication sponsored by Alder McCarthy on behalf of the Waterworks Commission requesting permission to enter into a developer's agreement for the Christina Estates East Development Project Cedarwood Homes LLC developer. Recommendation of Waterworks Commission on 820 to approve with a referral to Finance and Personnel Committee. Staff recommendation that the mayor and city clerk be authorized and directed to enter into a developer's agreement for the Christina Estates East Development Project Cedarwood Homes LLC developer. Fiscal note, developer paid all costs associated with the installation of the water main, estimated at $80,000. Director Tillett.
So just like the last item, this also is a developer's agreement for 10 single-family homes. And this is 400 feet of 8-inch water main. And it's located on Hunter Drive, north of Washington Avenue and east of Emerson. Again, this is a developer pays the cost to put the pipe in the ground per our specifications, and then we maintain it.
Any discussion on that? I'll entertain a motion.
Move to approve.
Second.
All right, it's been moved by Alder McCarthy and second by Vice President, the Vice Chair, Sebastian, all in favor signify by saying aye.
Aye.
Opposed? Motion carried. Thank you. All right, now we're gonna move back up to the top.
Item number
Just
06.
remember
Item number 0670-24, communication sponsored by Alder Horton on behalf of the Public Health Department requesting permission to enter into a contract agreement with State of Wisconsin Department of Health Services for the Wisconsin Tuberculosis TB Dispensary Program. Staff recommendation that the Public Health Department be authorized to enter into a contract agreement with DHS DPH for the Wisconsin TB Dispensary Program. Fiscal note, the city will get reimbursed at the Medicare reimbursement rate if services are provided. Deputy Public Health Director Fergus is here to speak on the item.
Thank you. Good evening, Alders. I appreciate the opportunity. So this would be a new contract that we're entering into. What this contract does is it allows us to help individuals that do not have insurance. It helps us to keep our initiative to support the city's goal to expand healthcare access for all regardless of insurance status. So public health monitors and case manages all latent TB cases as well as active cases, meaning that they're active and they have an infection that is contagious. So with that being said, sometimes it's extremely hard for individuals to get into providers. So with this, we have an agreement with our medical director and Ascension that they would see the patients, bill them at a MA rate, the health department would pay it. We submit reimbursement, or we submit the invoice to the TB dispensary, and then they give us something back. So there's no funding for the city except putting that cost forward, but then we would get it back. So I'm excited about this opportunity. We have had several patients each year for the past few years that could very much have benefited from this. So I'm looking forward to having this approved.
That's a quick question. Is this the kind of thing that we handle through the new health clinic in the long run? That outcomes best?
It would definitely help with the providers, yes. The dispensary has to be through local health departments, so it can't be through a healthcare organization, but to have additional providers for our patients to see will be very beneficial.
I meant specifically our very qualified health center that we're just working on now. Would they be allowed to dispense this, et cetera?
They would be able to see the patients. The dispensary is only applicable to health departments.
Okay.
So,
Thank you.
Any other discussion?
I do have a question. So have we done TB dispensary programs in the past?
we have not.
So like through my research, it's grown by about 6% since 2020. So is that why it's on the table now where it hasn't been before? Because we've noticed that this has been something that has arisen.
Yes,
Okay.
between that and then also having more providers that are willing to take the patients and reimburse us at an MA rate. So,
Thank you.
mhm.
So we have a motion, by Alderland. I'll second it. So Alderland made the motion and I second it. So all in favor signify by saying aye.
Aye.
Opposes? Motion carried.
Item number 0671-24, communication sponsored by Alder Horton on behalf of the Public Health Department requesting permission to enter into an agreement and accept $35,000 from the Wisconsin Coastal Management Program for continuous monitoring of water quality parameters in the Root River, control number 00584. Staff recommendation that the Public Health Department be authorized to enter into an agreement and accept funding from the Wisconsin Coastal Management Program for continuous monitoring of water quality parameters in the Root River, control number 00584. Fiscal note, grant amount is $35,000. The city will provide a soft match of $52,774 in the form of personnel, salaries, fringe, existing river monitoring supplies, and overhead costs. Director Fergus.
Thank you. So the River Watershed Restoration Plan aims to improve water quality through continuous monitoring of key water parameters, such as the temperature, pH, specific conductance, dissolved oxygen, and turbidity. So to achieve this project, we'll set up continuous monitoring stations at Colonial Lincoln Park and Racine. This involves purchasing and installing sensors and telemetry equipment, maintaining them, and making the data publicly accessible. So, as discussed before, the grant will cover the cost of the equipment, as the sensors and the telemetry. And then the city, we will provide the personnel salaries, existing river monitoring supplies, and overhead costs. So the project will enhance water quality monitoring and provide valuable data to the public, contributing to better watershed management.
Any discussion on that?
Sure.
Vice Chair.
So as, with harbor commissions, and other grants like statewide, with some of the 12 and acts and things like that, it's been a conversation that we've had, that you have had, but perhaps that can overlap and we have more of an option for just for what we're doing with that, or.
I'm gonna actually, I brought AJ with me. AJ is our laboratory grant coordinator, so any questions you can forward to AJ as well.
We have not had conversations with the Harbor Commission on that. We have had conversations with Sewer Pack and on that other local organizations.
My recommendation, and I don't know where it went, because I haven't been at the last two meetings, but I know that they were really working towards getting large state grants for Root River and this type of research. So as we're looking at 52,000 spent on ours, perhaps there's an opportunity to get additional grant money. That's all I just wanted to point out. That's all.
Okay, thank you. We'll take that in consideration.
Any other discussion? Other neighbors?
Thank you. So, with the soft match, is this a new position or how would this, tell me more about the match,
Sure.
yeah.
So, so the match is already, it is not a new position. It is already funded staff. So staff, are already going out and monitoring the river. So, but this equipment, sorry, excuse me, this equipment would help, give us a better visual of the data that we can share.
Any other discussion? Entertain a motion.
Move to approve.
Okay.
Right, it can move by Alder McCarthy and second by Alder Land. All in favor signify by saying aye. Opposes? Motion carries. Next item.
Item number 0673-24, communication sponsored by Alder Horton on behalf of the Public Health Department, requesting permission to accept funding of $25,000 from the State of Wisconsin Department of Health Services Communicable Disease Harm Reduction Section for the Integrated HIV Prevention Targeted Grant Control Number 00583. Staff recommendation, Public Health Department be authorized to accept funding of $25,000 from the State of Wisconsin Department of Health Services for Integrated HIV Prevention. Control number 00583. Fiscal note, grant amount is $25,000. There is no match required. Deputy Director Fergus.
So the integrated HIV prevention grant, that we'd like to receive from DHS will enhance, and advance efforts to end the HIV outbreaks. We will be using this funding for condom and safe sex supply distribution to prevent the HIV transmission. We'll be using some of it for advertising and outreach to promote awareness of HIV testing options and other preventative methods like the different medications to reduce the risk of HIV transmission. And then we'll also be working on community engagement. We want to educate the public, address misinformation that may be out there, and foster collaboration with local partners and communities affected by HIV. So the grant will complement existing funding. We'll be able to do more with the grant amount that we're providing. Any questions?
McCarthy.
Talked about TB being on the increase since 2020. What's the trajectory of HIV in that community?
So in our community, it's still less than 1%, but there has been an increase since 2020. A lot of that has been due to testing though during COVID. Unfortunately, providers were not testing a lot. So now we are getting this out there. We've been doing more testing within the health department, as well as doing more education with providers to have them begin testing again. So it has gone up right now. Currently, to date, we are not where we were last year. Last year we had approximately, there were approximately 25 cases, so we are under that fifth year. So I'm hoping that we're going in the right direction, getting more information out there and more testing available to individuals that need it.
Any other discussion on that? This time I'll entertain a motion.
Move to approve.
Right.
Second.
All right, been moved by Alder Davis, second by Alder Land. All in favor signify by saying aye.
Aye.
Opposes? Motion carries.
Item number 0674-24, communications sponsor by Alder Horton on behalf of the Public Health Department requesting permission to enter into a contract and accept funding of $5,757.69 from the Department of Agricultural Trade and Consumer Protection for the 2025 Clean Sweep Unwanted Prescription Drug Grant Contract, control number 00582. Staff recommendation that the Public Health Department be authorized to accept funding of $5,757.69 from the Department of Agriculture, Trade, and Consumer Protection for the 2025 Clean Sweep Unwanted Prescription Drug Grant Contract, control number 00582. Fiscal note, grant amount is $5,757.69, and a soft match is required of $1,919.23. Deputy Director Fergus.
Sure. So this is a continuing grant. We've had this grant for over 16 years. It's a community initiative that focuses on safe disposal of unused and expired prescription medications. Helps to prevent drug abuse and environmental contamination by offering secured drop box locations. We have 13 throughout Racine County, and we have 3 in the city of Racine. We also schedule collection events. So these programs ensure that medications are disposed of responsibly, benefiting public health and the environment. Annually, we collect about 3,000 pounds of medication in these drop boxes a year. So the cost covers the facilitation of the drop boxes. We work with law enforcement. That's where a lot of our drop boxes are throughout Racine County, as well as a couple of the Walgreens. So it goes, the funding goes to help them for their time of collecting the medication for DOJ. There's a soft match that comes from the health department just with putting the grant together, writing the reports, getting the information out to all of our local partners.
All right.
This coordinate with the wastewater collection events they do, I think those quarterly as well, or when you say you events, is it the same events we're talking about?
No, they are different events. Yes. So and we haven't had so this one is with DOJ, Department of Justice, and they so we let them know about the events, and they organize the event with different pharmacies throughout Racine County. So it is different.
Thanks.
Further discussion? Not, I'll entertain a motion.
Move to approve.
Second. All right. No. All right, motion by Alderman McCarthy, second by the Vice Chair. I get to the Vice Chair. All in favor signify by saying aye. Opposes? Motion carries.
Item number 0675-24, communications sponsored by Alder Horton on behalf of the Public Health Department requesting permission to accept funding of $104,784 from the State of Wisconsin Department of Health Services for the Mike Johnson Life Care and Early Intervention Services Grant, control number 00581. Staff recommendation that the Public Health Department be authorized to accept funding of $104,784 from the State of Wisconsin Department of Health Services for the Mike Johnson Life Care and Early Intervention Services Grant, control number 00581. Fiscal note grant amount is $104,784, and there is no match required. Deputy Director Fergus.
Sure. So this grant, this is a one-year grant. This funding will support, we have a public health educator that also serves as our PrEP navigator. So this person, in their role, they are enrolling clients in PrEP, which PrEP is a medication where patients can take pill once a day to prevent their chances, well, not chances, but to prevent them from getting HIV. So this is something we're really trying to push. If taken every day, it reduces the chances by 99%. So, but with that, there are labs that need to be drawn. monthly and then every 3 months and every 6 months. So this is where this grant comes in to help. So for those that are underinsured or uninsured, this grant will allow us to pay for the labs that need to be done. And also pays a portion of this individual's staff time so that she will call them up. She'll make sure that they're getting in for their appointments, that they're coming in to see us so that, and they're not missing any doses with their medications. So this is our second year with this grant. We have enrolled individuals in this and we hope to continue, and it becomes an ongoing grant that we can.
When we say staff time, are you talking about someone that's already hired through the department?
She was hired with part of this time last year. So we were able to get a part-time position. And then we also have, she's half city letting and half grant funded.
Oh.
So, but she's already been with the department.
Any other discussion on this item? I will make a motion to approve this item. All right, so it's been moved by the chair and second by Alder Davis. All in favor signify by saying aye. Opposes, motion carries.
Item number 0676-24, communication sponsored by Alder Horton on behalf of the Public Health Department requesting permission to accept the Communicable Disease and Prevention Grant Control number 00580 in the amount of $5,810 and additional funding in the amount of $2,100 for the Consolidated Immunization Grant Control number 00550, that should say, from the State of Wisconsin Department of Health Services. Staff recommendation that the Public Health Department be authorized to accept the Communicable Disease and Prevention Grant Control number 00580 in the amount of $5,810 and additional funding in the amount of $2,100 from the Consolidated Immunization Grant Control number 00550 from the State of Wisconsin Department of Health Services. Fiscal note, Communicable Disease and Prevention Grant Control number 00580 in the amount of $5,810 and additional funding in the amount of $2,100 for the Consolidated Immunization Grant Control number 00550. No match is required. Deputy Director Burks.
So on these two grants, they are both reoccurring funding that we've had for years. Various activities including communicable disease surveillance, investigation, contact tracing with that 5810. Also the additional money, the $2,100 for the Consolidated Immunization Grant was provided for our perinatal hepatitis B case management that we do for individuals. Both of these grants go to support a public health nurse who is 100% grant funded.
Any discussion on that? Entertain a motion. All right, it's been moved by Alderman and second by Alder Davis. All in favor signify by saying aye. Opposes, motion carries.
Item number 0677-24, communication sponsored by Alder Horton on behalf of the Public Health Department requesting permission to enter into an agreement and accept additional funding of $150,000 from the State of Wisconsin Department of Health Services for the Public Health Vending Machine Program Grant Control number 00586. Staff recommendation that the Public Health Department be authorized to enter into an agreement and accept funding of $150,000 from DHS for the Public Health Vending Machine Program Grant Control number 00586. Fiscal note, grant amount is $150,000 and there is no match required. Deputy Director Burgess.
So this is exciting. We currently had one public health vending machine at the transit center since last December. I'm sorry, December before that. And now this year we applied and we received 2 more vending machines that will be put. One will be going down by the Racine Public Library. The other one will be for John Bryant. So in these vending machines, we will be able to expand the supplies that we put in these vending machines. So we'll have Narcan in there, fentanyl test strips. We'll have other packaging items, safe sex kits. We will have wound care kits, hygiene kits. It's endless what the grant will allow us to put in there. And I think it will be very beneficial. We'll be able to put either the same items in all of the vending machines or kind of tailor them to the needs. So, we have no further information on the vending machine.
Alderman Carr.
So this grant is both for the actual machines as well as to be able to stock the machines that we're using?
Yes, it's for both machines, it's for the operation, it covers the insurance on them.
How were the locations, decided?
So we did, we worked with other community partners, we also worked with, our fatality review team, to determine, we're trying to saturate, the whole city in different amounts instead of always put them in the same locations. Behavioral health has also had, behavioral health for Racine County, they get Narcan out too, so we worked with them so that we didn't distribute in the same areas, making sure that it was available to.
Thank you.
So,
And I feel a little silly that I don't know this answer and I should already. So with these vending machines, what is the cost for someone to purchase from these vending machines, some of these out
there is no cost.
there? Okay, so they just,
Mhm. So, there's directions on each of the vending machines. We ask them to put in their zip code because we do collect data off of the vending machines. So once they put in their zip code, it will drop down the items that they request.
so then my next question is, as we're talking about these grants, and you said it's for this one specifically, and I should have asked before, but, so this is for operations, so are they restricted, unrestricted, as we're going through, or they're kind of all the same?
As far as.
Like, you know, so for operations, you know, for maintenance as well as, you know, the stock, if you will, is this kind of all the grants that we've been talking about? It includes everything, so they're non-restricted grants?
Well, so everything we've talked about putting in the vending machines, it allows for us to do that.
Okay, including apps.
Mhm.
And then, and I should have asked on the previous items, similar, that they're unrestricted grants as well, including apps for it.
Yes.
Okay, thank you.
I just have one question. So I know we had one of the machines down at the transit center. But do you have any type of like numbers? Was it used a lot? Was it a lot of did people get a lot of Narcan out of there or fitting strips?
So we have kits and they come in at like a pencil box. So there are fentanyl test strips in there, there's Narcan in there. There's a few Band-Aids and sterile water. So it comes in a kit. We have dispensed 898 kits just this year.
Pencil kit, that's old school.
A little bit discreet.
Weird, different.
You know, the transit center, it's nice because it's located inside, but it's by the other vending machines. So when you walk in, you know, it's very discreet if somebody would like to go get something out of it. The one for John Bryant will be located inside, and we are trying to work with the vendors to do an outside vending machine at the public library.
Any other discussion on this item? At this time, I'll entertain a motion. All right, can I get a second?
Second.
All right, been moved by Alder Davis and second by Alder Land. All in favor signify by saying aye. Aye. Opposes? Motion carries.
Thank you, Alderman.
Thank you.
You can have a great evening.
Item number 0735-24, communication sponsored by Alder Land on behalf of Parks, Recreation and Cultural Services Director requesting permission to accept the DNR IRA Urban Forestry Grant from the Wisconsin Department of Natural Resources Inflation Reduction Act funding to support the Parks, Recreation and Cultural Services Forestry Division, control number 00560. Staff recommendation that the Parks, Recreation and Cultural Services Department be granted permission to accept the DNR IRA Urban Forestry Grant from the Wisconsin Department of Natural Resources Inflation Reduction Act to support the Parks, Recreation and Cultural Services Forestry Division, control number 00560. Fiscal note. Grant amount is $453,450 over a 3-year period of time. There is no city match. City Forester Nick is here to speak on the item.
Thank you. Evening, everyone. Was a mouthful, by the way. The emerald ash borer is an insect from China. It found its way to the U.S. To Michigan in 2002, and it is fatal to ash trees. We found it in Racine in 2011. At that time, we had several thousand ash trees as street trees and park trees, and several thousand more in our park system. So over the last 12 years, we've been slowly removing these trees. In order to buy time, we've also been injecting them with pesticides so that they are resistant to the emerald ash borer for the time being. This grant will provide funds to remove approximately 200 ash trees out of our park system and to replace them with 400 new trees, all work to be done by contractors, which allows our city crews to keep doing the work that they do. In addition, funds will pay for approximately 1,000 trees in our park system to be pruned. We have established over the last 10 years a pruning cycle for public street trees. It's the first in Racine. We're on a 6-year cycle for pruning street trees and a 3-year cycle for pruning small trees. But in order to get to that point, we really had to do some deferred maintenance in the park system and just do like safety pruning as opposed to real thorough work. So these funds will pay for, again, a contractor, one or more, to prune trees in specific parks. And then lastly, we also have a partnership with UW Extension that would involve hiring a limited term employment person, bilingual, to do outreach in underserved census tracts that are also low canopy. The purpose being to educate people about the benefits of trees and then to actually provide them with the tree that can be planted on their property. What summarizes it.
Any discussion on this item? All right, Alder Land.
What kind of trees are you gonna be replacing their old ash borer with?
We plant approximately 45 or 50 different species and have been doing so since 2012. There are native trees, maples, elms. We're trying to diversify so that we don't have the next emerald ash borer problem or the next Dutch elm disease problem. We have a lot of maples right now, so we actually would not be allowed to plant maples as part of this particular grant. We plant a lot of, we do plant elms again. They're hybrids that are resistant to Dutch elm disease. We plant trees called Zelkova that are from Japan. They're similar to elm. We plant oak trees, a lot of oak trees. Oaks are largely native and they do provide benefits to birds due to the insects that are attracted to them. So there are really a lot of trees that would be, options.
One more question. Is there hope for the ash trees or?
There has been some, I'm not super updated on the research, but there has been some indication that some trees may be slightly resistant to it, such as blue ash. Unfortunately, we have like 12 blue ash in the city, so no long-term real hope for those. I think the expectation is that there is a wave of trees being killed or a peak, and the trees that are being protected, once that peak has passed us and we're on the downhill slide, we may be able to treat remaining trees less frequently than we do now. We're currently on a 3-year treatment cycle. Maybe that could be extended to a 5-year or a 6-year. It's really unknown. The research is continually ongoing. We only have about 12 or 1,300 ash remaining in the city on our properties. So right now our goal is really to remove and replace all of them. And perhaps in the future we'll be able to plant ash again though.
Thank you.
Andre, this.
Thank you. Is there a possibility, or tell me why not, like fruit bearing trees?
Certainly a possibility. It's something we don't do in street trees because of the mess on sidewalks and streets. I personally want to focus on shade trees because they do provide stormwater reduction, shade, the best environmental benefits. Fruit bearing trees are often smaller and really they require specialized cutting. If you've been to an apple orchard, you'll notice that they're all short, and that's one to reach the fruit, and also the cutting of the trees, the pruning of the trees is done in a way that actually increases fruit production. And those are things that we wouldn't be able to really accomplish.
Thank you.
Welcome.
The more you know.
Any other discussion on this item? I'll entertain. Yeah, discussion. No. I'll entertain a motion for this item.
I would like to move.
Second. Okay, so we have motion by Vice Chair and second by Alder Land. All in favor signify by saying aye.
Aye.
Opposers, motion carried. Thank you.
Thank you.
Okay, item number 0737-24, communication sponsored by Alder Pete on behalf of the Community Safety Director requesting permission to award RFP number 6, 2024, Community Violence Prevention Providers to Payne Consulting LLC, $50,000, Women Resource Center Incorporated, $41,359.42, and Focus on Community Incorporated, $50,000. Staff recommendation that the purchasing agent or designee be granted permission to award RFP 6, 2024, Community Violence Prevention Provider to Payne Consulting LLC, $50,000, Women Resource Center of Racine Incorporated, $41,359.42, and Focus on Community Incorporated, $50,000 for the period of July 2024 through December 2024. Fiscal note, total funding of $141,359.42 is available in 20314-52200-20149 Community Safety Fund Grant. Director of Community Safety Tate is here to speak on the item. I don't even know. Tate the second.
Thank you. Good evening, Alders. So as you heard, we are releasing funds as was indicated in the budget this past year. That we're going to issue funds into the community for violence prevention programs. We did set in early June open bids. So we received 14 solicitations that were approved through the purchasing agent, who was the deputy director of finance at the time, who evaluated the fully compliance applications. We then conducted internal reviews and scoring of those, ultimately landing on these 3 proposals. Focus on communities. Intention is to focus on substance use treatment and care for high schoolers. Payne Consulting's program is mentoring for middle schoolers, and Women's Resource Center is providing legal services for their clientele who are dealing with domestic violence and support and navigating through the court system. So those rewards were identified based on scoring, but as well as need. So Payne and Focus both had the highest scores. Women's Resource didn't have the highest score, but it also met a particular need within our community that we recognized over the last couple of years for an increase of domestic violence. So the internal team decided that rather than going strictly with 1, 2, 3 on the scoring, many of which were all very youth oriented, we wanted to also address another aspect of our community that is dealing with violence and provide resources in that direction. So certainly, if there's any questions.
Vice Chair Sebastian.
So Women's Resource Center and Focus on Community are 501c nonprofits. Payne Consulting is a for-profit entity, correct?
Yes.
So I guess where I'm going with this, and I absolutely adore the work that Payne Consulting does, and especially what they did with the King Center and things of that nature. I just have a little bit of a hard time, and I'd love to hear the conversation about us giving money for a for-profit center. And I used to be on the board for Women's Resource Center and work with Focus on Community. So I just want to understand, I guess, where the justification is at for a for-profit, because we just paid them what, however for the King Center. Yeah, so I guess I just want to see how, I guess I'm just curious as to the juxtaposition between the nonprofit and the for-profit.
Well, there was no designation
Okay.
of who could apply or
Okay.
submit proposals. We simply opened them up. And those who submitted proposals that ultimately were scored the highest and met the criteria that we were looking for, which is all in compliance with our prime funder, which is the Medical College of Wisconsin, through the Wisconsin Community Safety Fund. So they met the objectives that we are beholden to. And ultimately had a proposal that scored second highest behind Focus on Community. And so in terms of merit and meeting a need, and also addressing a different population with focus on high schoolers. Payne is actually dealing with 9 to 13-year-olds, which is middle school. They felt both appropriate in terms of merit, but also in terms of targeted population. So there was no prohibition in terms of what the structure of the organization is.
Thank you for the presentation. Good date. Would it be appropriate to say we're not really as much handing them money as we're buying services from them, and I assume we have measurable results from each of the.
Yeah, so this did go through the RFP process, so essentially these are professional services. This was the structure that seemed most appropriate and efficient in allocating what is almost effectively a grant. They are gonna serve as sub-recipients to us as we are recipients of the medical college, which is a recipient of the state of Wisconsin, which is a recipient of the federal government. So it's going to work its way back up in terms of those levels of compliance and requirements. But yes, these will be, so funds will be released on a invoicing basis. So as they provide service, they will submit their invoices and we will reimburse. These are not front loaded funds, and that is very clear to our recipients.
So also on that question, oh, I'm sorry, that was it. And I don't know what, off the top of my head, what Women's Resource Center Racine's budget looks like at this time. But I know that it's very challenging sometimes for nonprofits to receive reimbursable grants because they don't have the upfront cash as Women's Resource Center. And I do know focus on community off the top of my head, but are they prepared to be able to offer the services to be able to receive the reimbursable? Do they have enough money up front?
They have not expressed any concerns about not being able to manage with a front end cost and then you have.
Okay, that's something that I would look at, of like, I know you already have, but just being in the grant world that I'm in, that's, you know, what I do is, that's so challenging sometimes and I know that they've been struggling for so long and it's such an amazing organization. So have we ever, and I know this, I don't know if it comes up or it has come up, but as far as doing reimbursables, as far as pre-reimbursable grants, has this been a conversation that has been had at this table at all?
So if I may,
Yeah.
sorry, that would be something generally that would be restricted by the granting agency. In this particular case, I assume that the original funding source is probably ARPA funds from the federal government. It would be restricted, we can't.
And I totally get that. I just hope that they're able to operate the services with the reimbursement.
Any further discussion? This time, I entertain a motion. Approve.
Second.
All right, motion by Alderman McCarthy, second by Vice Chair Sebastian. All in favor signify by saying aye. Aye. Opposes? Motion carried. Thank you. All right.
I will read the closed session language, then motion second, roll call, you guys don't. It is intended that the Finance and Personnel Committee will convene in closed session pursuant to Wisconsin statute section 19851E to address matters that for competitive or bargaining reasons require a closed session.
We entertain the motion to go into closed session.
Closed session.
Second.
It's been moved by Alderman McCarthy and second by Alderman to go into closed session. All in favor signify by saying aye.
Roll call.
Oh,
Roll call, please.
roll call.
Yeah.
Alder Gordon,
Aye.
Alder Sebastian.
Aye.
Alder Davis,
Aye.
Alder Land,
Aye.
Alder McCarthy.
Aye.
That completes roll call to go into closed session. Just give me a moment to adjust the screens here.